So joining us on the show right now is the co-founder and CEO of Octodoc, Mr. Mark Ugboma. He'll be speaking about transforming healthcare accessibility in Nigeria. Welcome to the show.
Thank you for having me.
All right, so when it comes to indices of development in any country, we're always talking about education, health, basic infrastructure being available, and a country cannot grow beyond the health of its citizenry. So what exactly is Octosoft doing to make healthcare more accessible to Nigerians?
Thank you very much. So Octosoft is a health tech company. We are focused on transforming healthcare experiences for individuals, for corporates, for governments, and for communities. So what we've done is we've developed a product, which is our Octodoc app. It's a mobile application which we've built with a focus to enabling access to quality healthcare. One of the challenges that we have experienced post-COVID-19 pandemic is, a situation where many of our doctors have relocated to other developed climes. This brain drain that we have seen, Japa syndrome, as we say, that has resulted in Nigeria losing a number of qualified doctors. As a result, at the moment, we have just about 35,000 doctors to a population of 220 million people. This creates a scenario where we have one doctor serving about 8,000 people, which is way below the standards set by the World Health Organization, which is one doctor to 600 people. So what we have done is we have used technology to try and broaden the access to healthcare, through our mobile app.
All right.
Okay, so this mobile app is called Octodoc.
It's called Octodoc.
Okay, so what are the specific features of this app?
So Octodoc is an app that runs on both your Android mobile phone. So if you use Samsung or any other Android phones, you'll be able to access it from the App Store. If you're using iOS, you'll be able to access it as well. The app itself enables people to be able to book appointments with doctors. So what we've done is we've aggregated hospitals into this platform. We call this app a digital front door. So digital front door to your healthcare service. So we've aggregated different hospitals. And if you want to now book appointments to see a doctor, you just go on the app, you'll be able to book an appointment. A lot of Nigerians complain about hospitals, time wasting, queuing up, and all that stuff. So we are trying to eliminate that, streamline that, because those complaints result in many Nigerians seeking self-help. When people are unwell, they just go to a pharmacy or to a chemist to buy medication rather than speak to a qualified doctor. Some people even go as far as calling a nurse to come and give them drips, injections at home. Well, we're saying the human body is very complex. We shouldn't just treat it the way we like. We should talk to the experts who have been trained for many years to help in that regard. So Octodoc allows you to do that. So in addition to being able to book an appointment for your physical, not just the virtual, for a physical in-person appointment to a hospital, so that when you have that appointment, you know when to go in.
Okay.
Your appointment is for 11 o'clock, you get in for 11 o'clock. You don't have to get in at 5 or 6 and queue. So we are trying to eliminate that, streamline the process. But it also allows you to do telemedicine. So if you don't want to go physically, you can do it virtually.
Okay.
Yes, you can do it virtually as well, to speak with the doctor.
Okay, so this is a very good development, and it's like a health insurance business, right? So what differentiates you from other health insurance businesses out there?
So we, as Octosoft, we are not a health insurance company, but we aggregate health insurance companies. So we have a number of health insurance providers already on the platform today. Any individual can download the app. You would see health plans from all the health insurance, Bastion, Leadway, NM Health, all of them. We've put them on this platform, IGEA, whichever one you want. So rather than going to individual HMO's website to research what plans to buy, we've put them together, compare them side by side, so you can quickly take that decision on buying health insurance. And we know the benefit of health insurance. Insurance for your car is in case of emergency, you know you are covered. You know, you don't have to bring all the money out in the case of emergency because you have insurance. Likewise on your health, you know, you're covered in case of serious illness. Your health insurance product will be able to support you in that regard. So
I was going to ask how wide is Octodoc, because you know when we see this app now, I think it covers a lot and even into the remote areas of the country. But you'll be surprised that it'll be in the only in the capital. I know some hospitals in the capital. So how wide is it really?
So we've just launched, but we are growing really fast. And one of the reasons why we're here is to promote this app a lot more. What we've seen since our launch is that some of the customers that are calling in are actually calling from remote areas. So people that have, we've seen callers from Akure, and other parts of, the country saying, they don't have doctors around them, but they need this care. So we are nationwide. The good thing about technology is you can reach anyone anywhere. Today we pick up our mobile phones, call people in Maiduguri and people in Cross River State, everywhere. So that's the reach, that's the access, which is what we are promoting through this technology to make sure people can reach doctors regardless of where they are.
Okay, so would your target audience be hospitals, insurance companies, and could that also be your target audience so that they get on the app
onboarding,
and then clients would? So just a one-stop shop, hospital, health.
Wise.
Yes, health sector.
Exactly.
Let me put it that way. Okay.
Exactly.
Okay, so what happens for a user now? Is it user-friendly? Can I go on as a user and pick a hospital, or I just pick a doctor?
Okay, so the choice is yours.
Okay.
We've made it such that it's very flexible. Already we've onboarded several hospitals on the platform. So if your hospital is one of them and you want to engage with your hospital, you can.
Okay.
When you download the app, sign up, you can use your hospital. There's a number of hospitals there already. We are scaling to get more hospitals on board. And these hospitals, when we bring them on board, they bring their patients as well. So they tell their patients, now we have telemedicine.
Okay, so it's like a software that can be used by hospitals, as well as by HMOs and as well as individuals. So it's like a holistic. I wanted to ask you about because among the things that you're offering as service is also the health information being in a same place, and it is addressing the problem of the fact that people have emergencies and they go to an hospital to visit a hospital and find that I lost my cousin. She has diabetes and she's being treated for diabetes, but when she had a crisis, she was rushed to the hospital, and because they felt she was faint, they gave her a drip that had glucose. She died. If there was a way to get that information on a software, a software format that any hospital you get to, you can just show them, they see your record. How does this now solve that problem, and how many people have access to?
Very good question. So one of the features is your health history. So the app, under your profile, you'll be able to see your health history. So as you consult with the doctor, when the consultation is done, you get a copy on the app. So you can take that health information wherever you are going. In the future, we are looking to add things like care for chronic conditions. So people diabetic or high blood pressure, you can be able to then monitor, medication intake as well. So where you've been prescribed, okay, take this tablet once a day, once or 3 times a day in the morning. You can, as you take them, you can check it off. Okay, and your doctor can see it and be able to monitor you remotely. So things like chronic care becomes even easier to manage.
Okay, so 2 things that discourage Nigerians is money.
Money.
So is it affordable? Exactly. And number 2, the ease of the app.
Yes.
For instance, if I have a hospital that is not captured in the app, can I upload suggest my hospital as one of the options so that
we can speak with them? Absolutely. That's we have a feature that allows you as a patient to say, oh, I can't find my hospital on this. When we see people make such references, we can show the hospital, look, your patients are already here. Be where your patients are. Come on board. Coming on board, it's pretty straightforward for the hospital. And you as a patient, right, if you're consulting with your hospital, every transaction you're doing is with your hospital. The normal fee you pay them, you pay them. But on Octodoc, we also have a set of doctors who are there on the platform that you can speak to for just 1,000 naira.
Wow.
Yes.
I didn't know. I didn't know.
Very good. So, do you have physical offices?
Yes, we do. We do have a physical office. We are
Yes, because I know there are so many people who are not educated that have just that phone,
Balasa.
that balasa phone. So how will they reach out? Those kind of
okay. So
solution for them.
yeah, we are not solving every problem today, but we will.
Eventually.
Exactly. We are looking to partner with some state governments so that we can deploy this technology to primary healthcare centers,
Yes.
where people can work in and still be able to access this service. So we are working towards that as well.
Thank you so much, Mr. Uche, for joining Mr. Mark
Uboma.
Uboma.
Yes. Just before I go, can I just quickly say we are giving away, we're doing a promo, so we're giving away 50 to 50 lucky customers who downloads the app to their phone and sign up. Once you sign up, you would get 3,000 naira to your account.
Okay.
So you also have an account on the...
Yes, the app, we have a wallet for you. You can just, so we're going to give you 3,000 naira when you sign up. The app is Octodoc, O-C-T-O.
Also, for everybody that signs up now, 50.
Using promo code YOURVIEW. One word, your view. One word, your view. Sign up, and you get the 3,000.
You just mentioned that you didn't mention before that we can have payments. You can have a savings if you have a wallet.
You can
have a saving towards your health.
Yes,
Wow.
exactly.
That's good.
Yes.
Thank you so much. It's
Octodoc.
definitely...
Thank you for having me.
Octodoc is the platform they search for on their phone, iOS as well as Android being covered.
Yes.
We wish you all the best.
Thank you.
Don't forget to use the promo code YOURVIEW so that you can get the 3,000 naira voucher, which you can then use to consult on the platform.